Thank you so much, Lizzie. Thanks for having me. And thank you to everyone that's either joining live or watching the replay. It's really great to be here. Without further ado, I'm going to jump into the content. Let's get started. All right, so hopefully you can see that okay. So yeah, this topic is dear to my heart. I think it's a very important topic. And my mother has just been diagnosed with osteoporosis in her spine. So she has been recently diagnosed with celiac disease, which many of you will know is like a severe allergy to gluten. And it means she hasn't been absorbing nutrients and vitamins for quite a long time. So it's been interested in kind of helping her with this as well and helping her navigate kind of what can be potentially kind of a scary journey for someone who just has the diagnosis. It's a lot to to get used to. So it's been wonderful for my teaching career to help other teachers and also to help my mother. So yeah, so it's a really important topic to me. So I like to use humor in my teaching. It's not because I think that bone loss is funny, but I like this cartoon because it also shows us that there was an old school way of looking at bone loss. It was like, oh, bone loss is just a normal thing that happens. Well, it happens to all of us, but it doesn't mean that there aren't things that we can do about it, So yeah. So I just wanted to include that. Okay, so let's look at what we're going to cover today in this hour. So we're going to explore how bone mass changes throughout our life cycle, and then we're going to define osteoporosis and look at how it is diagnosed currently, and that's shifting. We're going to discuss current physical activity guidelines for someone who has osteoporosis. We're going to explore whether yoga is safe for people with osteoporosis. We're going to highlight top tips for teaching yoga to a student with osteoporosis. Discuss whether yoga alone can prevent/reverse osteoporosis. And then we're going to critique a paper that's become very well known, 12-minute daily yoga regime reverses osteoporotic bone loss. We're going to look at that through a critical lens. So things to consider: enjoy the workshop. Don't expect to remember everything. Okay. Make the use of the replay, even if you're joining live. There's going to be a lot of information today. So, if you can rewatch it, you're going to double the amount of information you can retain. You can contact me. Actually, we're going to email you a list of all the references that I mentioned. That's going to be sent out to you by Lizzie when she sends you the recording. I'm going to encourage you to take time after the workshop to reflect on the content and write down 5 things that you want to take away with you. Okay. And then if you share those with someone in your life, you have got a really great chance of retaining that information. Yeah, so reflect, write down, and then share with someone else. And I do that all the time in any kind of learning environment. It works wonders. Okay, so just a little disclaimer, I have a medical degree. I'm no longer registered as a doctor. So this is an educational workshop, based on updating yoga teachers on the latest kind of evidence-based information on osteoporosis. This doesn't equate to medical advice. So whether you or a student has osteoporosis, you must consult a healthcare professional before implementing any of the activities that are shared in this. Yeah, so just to keep us all covered with that. And then something I like to share anytime I teach any kind of workshop, there are often lenses that get in the way of us actually receiving information. And when we're aware of those, we can push them out of the way and we're more likely to actually learn something new. So you might have heard of these terms before. Confirmation bias. One way of saying this is we can be so focused on information that confirms our pre-existing belief that we miss the wider context. Science is constantly evolving. So you might have learned about osteoporosis 5 years ago. Come with an open mind. The information likely has shifted and changed, in some way. Yeah. And then cognitive dissonance is when we reject any information that does not confirm our pre-existing beliefs. So if you feel like you cringe a little bit at any point, it might be because I'm challenging a pre-existing belief that you have, and there's this kind of automatic response often to like, oh, push that away. And if you can breathe into that and soften, you're going to have a better chance of learning something today. So just something to be aware of. So here's a little cartoon about confirmation bias. So something we all need to be aware of. So a couple of questions for you just to reflect on before we dive into the content. Do you believe that osteoporosis is irreversible? So do you think that once you have something like osteoporosis, it's just that's the journey, you can't reverse the process? What do you think? Have you heard that yoga alone can reverse osteoporosis? So if yoga is your main form of physical activity, it can help you to reverse osteoporosis. Have you heard of that or not? Can we make choices that reduce our risk of developing osteoporosis in the future? What do you think? Is it just inevitable, or things that we can do early in life that prevent it? So have a little think about that. All right, let's get to know our bones for a second. So our skeleton is this remarkably dynamic living tissue. It's very easy to think of the lovely skeleton that we see in an anatomy class and think of it not as living tissue, but it's dynamic, it's constantly changing, it's living. So it's comprised of a myriad of cells, of blood vessels, of proteins, minerals, nerves, okay? It's really, it's a living tissue like all the other tissues in the body. At birth, we have around 300 soft bones, which are transformed during childhood and adolescence into hard bones. And as some bones fuse during the developmental process, the average adult skeleton has 206 bones. Now, I've said average because there is human variation here. So we can have human variation in the number of the vertebrae in your spine and the number of ribs that you have. Men and women have equal ribs, by the way. And the number of digits we have, fingers, toes, and also in the sesamoid bones that we have in the feet. And even some people have a second kneecap called a flabella behind the knee. And around 20% of people have a second kneecap. Don't lose any sleep over it. You'll probably spend most of your life not knowing. It's completely fine. It's not going to limit you in any way or affect you in any way. So just very quickly on types of bones. I'm sure if you've done any sort of anatomy, you'll have covered this, but just a quick recap. So we have long bones, we have short bones, we have flat bones, we have sesamoid bones, and we have irregular bones, okay? So bones vary in size and shape and strength to respond to the demands of performing delicate or gross motor tasks. Yeah. So for example, the bones in the middle ear have minimal strength. They're tiny, but they play a role in the transmission of sound waves to the auditory organs of the inner ear. Like, how fascinating. Whereas other bones, such as the femur, so the thigh bone, they're exceptionally robust and can typically withstand enormous force before they fracture. Okay, in a healthy adult, yeah. Okay, so let's look at how the bone mass changes throughout our life cycle. Okay, so the size of our skeleton, the amount of bone contained in it, significantly changes throughout the life cycle. Okay, so peak bone mass is achieved by the mid-20s. We'll look at this on a graph in a second. And thereafter, a gradual decline into old age occurs in men. Whereas for women, they have a plateau after the mid-20s, but then they have an accelerated period of bone loss for several years after menopause. So let's take a look at that. So in gray, it's men. So men typically have higher bone mass. So in both genders, there's a peak in the mid-20s. And then for men, it's this very gradual decline over the years. And then for women, it's a bit more of a plateau and then a slightly steeper decline after menopause. So interestingly, decisions regarding nutrition and exercise impact on a child's likelihood or not of achieving their genetic potential for peak bone mass. So children, adults, some of this will seem like common sense. Ensure a nutritious diet with adequate calcium intake, avoid protein malnutrition and undernutrition, and maintain adequate supply of vitamin D, participate in regular physical activity. It's a big one. and avoid the effects of secondhand smoking. So there's been some research that's been done on this, and it's estimated that a 10% increase in peak bone mass in children reduces the risk of an osteoporotic fracture during adult life by 50%. So if you have a healthy childhood, you have a healthy diet, you're active, you're not around smoke, you're going to significantly reduce your chance of having an osteoporotic fracture in the future. So it was something really interesting that I came across. So let's look at how bones adapt. So there's a scientist called Wolff in the 1800s. He proposed that bone adapts its architecture to the stresses put on it. And this has become commonly known as Wolff's Law. Okay, use it or lose it, often people talk about. As loads are applied to the body, this mechanical stimulus is converted into electrochemical activity in a process known as mechanotransduction. Okay, you don't have to mention that in your yoga class. These signals are sent to the central nervous system, which responds by instructing the bone to build a stronger, denser framework to support the new demands. Like, how incredible. We're constantly adapting our body based on the demands that we put on it. It's really cool. So there are cells called osteoblasts. They're bone-making cells. They initially live on the outside of bone. They turn into osteocytes and become embedded within the bone, causing new bone to be laid down. And at the same time, we have osteoclasts. These break down older, damaged, or unhealthy bone tissue so that the materials can be reabsorbed for new bone. So there's a cycle here. New bone being made and old bone being broken down. Okay, so essentially our nervous system is constantly sensing how much bone strength is required and adapts accordingly. Okay, this is fascinating. So this whole process, this cycle, is known as remodeling. It's happening so frequently that every bone in the body is completely reformed about every 10 years. So every 10 years, you basically have a brand new skeleton. Okay, pretty incredible, every 10 years. And there's a little diagram here that shows this cycle. So we have the bone formation with the osteoblasts, and then we have the bone resorption from the osteoclasts. Just a natural cycle. So with physical activity, an adequate amount of hormones, calcium, and other minerals, as well as vitamin D, trabecular bone develops into a complex lattice structure that is lightweight yet strong. Okay. Force provided by muscular contraction can also provide enough stimulus to elicit bone adaptation. As muscles contract, they pull on bones, and that tugging can create enough stimulus to increase the strength of a bone. Okay, so that's good news. Now, this is a big one. This is a big one for us to really take on board as part of this topic. So there's something called the progressive overload principle. So in order for tissues to continue to adapt over time, load needs to be progressively increased in volume and intensity. So think of going to the gym. If you're lifting a 5-kilogram dumbbell and you've never lifted a weight before, yeah, you'll get stronger, but that will plateau. If you want to continue to get stronger, you will need to over time lift a heavier weight and a heavier weight. Okay, so this is the progressive overload principle. If you want to continue to get stronger and for your tissues to adapt, you need to progressively increase in volume and intensity. We'll revisit this a little bit. So another interesting thing about how bones adapt. So our skeleton is also constantly adapting to gravity. So astronauts lose an average of 1 to 2% bone mass per month in space. And this is known as spaceflight osteopenia. Okay. So most of the loss occurs in the lower limbs and the lumbar spines, the low back, with the proximal, the end of the femur, losing roughly 10% of its bone density every 6 months in space, even though the astronauts do resistance exercise training 6 days a week. So often, if an astronaut's in space for a long time, often they will not be able to walk off the craft. They'll have to be kind of taken off in a chair. Yeah. And then over time, they'll build that bone density back up in the following weeks when they're back on Earth. So yeah, so constantly adapting. Okay. So we've looked at how bone adapts. Let's now look at osteoporosis. So osteoporosis is a systemic So it happens throughout the body, skeletal condition characterized by low bone mass and microarchitectural deterioration of bone tissue that increases bone fragility and risk for fracture. So this is the big thing here. The reason why it's so important for us to know about bone decreasing in mass is that therefore it is more likely to fracture, okay? It's often referred to as a silent disease because there are typically no symptoms of osteoporosis until a bone is broken. So that's why it's important to get it recognized early, and it's important to know the risk factors for that. And then we also have osteopenia. So osteopenia is a condition of reduced bone density, but not to the level of osteoporosis. So some facts and figures about osteoporosis. It affects women and men of all races and ethnic groups. It can occur at any age, although the risk of developing the disease increases as you get older. For many women, the disease begins to develop a year or two before menopause in the perimenopause area. So let's look at some risk factors. So family history, your risk for osteoporosis and fractures may increase if one of your parents has a history of osteoporosis or hip fracture. Changes to your hormones, so low estrogen level in women after menopause, low levels of estrogen from the abnormal absence of menstrual periods in premenopausal women due to hormone disorder or extreme levels of physical activity. So you've heard of, say, a prima ballerina not having a period for a long time. That can be a risk. That can be a risk factor for future osteoporosis. Other changes to hormones, men with conditions that cause low testosterone, that's a risk factor. However, the gradual decrease in testosterone with aging is probably not a major reason for loss of bone. Diet's a big one. We've already mentioned it, beginning in childhood and into old age. A diet low in calcium and vitamin D can increase your risk. Excessive dieting or poor protein intake may increase your risk. Other medical conditions, I mentioned my mom has celiac disease, so different endocrine or hormonal diseases, diseases that affect your gastrointestinal tract, arthritis, different cancers, these are all risk factors for osteoporosis. Medication is a big one, long-term use of steroids, some anti-epileptic, it's a tongue twister for this morning, medicines, even proton pump inhibitors, SSRIs. These are all potentially risk factors for osteoporosis. So something to know about. And then lifestyle is a big one. So low levels of physical activity, prolonged periods of inactivity, chronic heavy drinking of alcohol, smoking, these are all risk factors. So let's look at how osteoporosis is diagnosed currently. So it's diagnosed on the basis of the presence of a fragility fracture or by bone mass measurement criteria. So a fragility fracture results from forces that would not normally cause a fracture, such as a hip or wrist fracture from falling from standing height, or a vertebral compression fracture where the vertebra there's a crush fracture in the vertebra of the spine, so that's not a normal thing. Although specific fracture sites have been considered more characteristic of osteoporosis, fractures occur at nearly every anatomical site have been associated with osteoporosis. Okay. So the most common bone mineral density test is the DEXA scan. Okay, and this is an example of one here on the side of what that would look like. DEXA uses radiation to measure how much calcium and other minerals are in a specific area of your bone, usually the hip and the spine. There's new technology called trabecular bone score, which takes a closer look at the DEXA scan, and it analyzes the structure of the bone. So this tells us about the quality, whereas the DEXA is really telling us about quantity. Okay, and then you might have heard of a T-score before. So if you're a woman in post-menopause or a man who is age 50 or older, your bone mineral density test result will be a T-score. Okay, a T-score is the difference between your bone mineral density and 0, which is the bone mineral density of a healthy young adult according to this score. Yeah. So the lower your T-score, the higher your risk of bone fracture. There's also a Z score. So if you are premenopausal or you're a man younger than 50, your test will be a Z score, Z score. I say Z because I'm British or Irish. So the Z score, Z score is the difference between your bone mineral density and the average bone mineral density for healthy people of your age, ethnicity, and sex. Okay, so if your Z score is -2 or less, your bone mineral density is low. Okay, so let's look at some of the diagnostic guidelines from the World Health Organization. So described in terms of the T-score, normal is -1 or higher. Osteopenia is -1 to -2.5. Osteoporosis is -2.5 or lower. And then severe osteoporosis is anything, is -2.5 and you've already incurred a fracture due to bone fragility. Okay. And these guidelines are shifting and changing over time. So approximately 17% of men and 30% of women 50 years and older meet the diagnostic criteria for osteoporosis. So that's a very significant number of people. This prevalence increases to 46% in men and 77% in women 80 years and older. So it's a big, big issue in our population. There's some research that has estimated that the lifetime risk for developing a major osteoporotic fracture in the spine, hip, forearm, or humerus is at 46% for women and 22% for men. So that's a big one. Each T-score standard deviation doubles your chance of bone fracture. So if you're -1 and then over time you're at -2, you've got twice the chance of having a bone fracture. Okay, so we're not going to look at pharmacological treatment today. It's important that it can help a lot of people. It does come with its side effects. We are going to focus on non-pharmacological treatment. Okay, so this includes, as we've mentioned, adequate calcium, vitamin D, protein intake, smoking cessation, fall prevention. That's a big one. This is where yoga can really come in, preventing falls, helping with their balance, avoiding bone-harming medications if possible, maintaining a healthy weight, remaining active with weight-bearing exercise. Again, yoga plays a role here. We'll go into the detail of this, and avoiding excess alcohol and caffeine intake. Okay. So let's look at some movement exercise guidelines. So this was a big paper in 2022. It was a consensus statement done in the UK. So what this means is meta-analyses, which are the gold standard of medical evidence, they were gathered and reviewed. And where evidence was lacking, individual studies or expert opinion were used to develop recommendations. And a multidisciplinary expert group reviewed the evidence to make recommendations, and they came to basically, a consensus on all of this. So let's look at what they found, what were the key recommendations. So people with osteoporosis should undertake resistance and impact exercise to maximize bone strength. Okay. You want to undertake activities to improve strength and balance to reduce falls. Okay, so the balance, definitely where yoga can come into play. 3, spinal extension, so back bending exercises to improve posture and to potentially reduce risk of fall and vertebral fractures. Okay. So they say avoid postures involving a high degree of spinal flexion during exercise or daily life. So extreme rounding of the spine, they're saying to avoid. We'll look at this as we go through. People with vertebral fracture or multiple low trauma fractures should usually exercise only up to an impact equivalent to brisk walking. Okay. Those at risk of falls should start with targeted strength and balance training. Okay. You can get a copy of the slides, Colleen. You can, we can send those to you tomorrow for sure. Yeah. Okay, so they say that vertebral fracture symptoms may benefit from exercise to reduce pain, improve mobility and quality of life, ideally with specialist advice to encourage return to normal activity. So really they're saying this needs to be done under the guidance of someone like a physical therapist. My pleasure, Karen. Everyone with osteoporosis may benefit from guidance on adapting postures and movement. This is a big one. There is little evidence that physical activity is associated with significant harm, and the benefits of being physically active in general outweigh the risks. Okay, so there's little evidence that physical activity is associated with significant harm. Okay. So here's some guidance from the International Osteoporosis Foundation. So they say that aerobic physical activity and progressive resistance training are safe. The intensity of the exercise sessions should initially be light to moderate and progressively increase. So remember, we looked at the progressive overload principle. Avoid powerful trunk twisting movements. Okay. Now, this doesn't mean that we should avoid twisting the spine, because that in everyday life, we just have to be able to twist the spine. But what I'm taking from this is we want to avoid using external force when we twist. So a lot of people will do a twist. They'll use the opposite arm to lever themselves into a twist. Use the control of your muscles to move your spine and don't use external force. This is what I'm reading from this. Yeah, so my take on this is to focus on mobility over flexibility. So think of the range of movement that you can control with your own muscles rather than using external force to pull you. Imagine you're twisting yourself in the chair. It would be avoiding using the back of the chair to pull you further into the twist. Yeah, so hopefully that makes sense. They say avoid trunk flexion exercise. Now, I believe that what they're referring to are stomach crunches, as this may increase spine fracture risk. Okay, so there are loads of other ways to strengthen the core. They're saying, particularly if you have osteoporosis of the spine, to avoid, stomach crunches. Trunk extension exercise and abdominal stabilization exercise are safe. Individuals with increased risk of osteoporosis fractures should avoid deep back bends. This makes sense to me. And activities that involve forward bending the spine, particularly while carrying an object. Okay, so we'll go into the nuance of this in a little bit when it comes to like recommendations for teaching yoga to someone with osteoporosis. Yeah. They say involving a healthcare professional is essential in designing an exercise program. So if you are teaching yoga to someone that has osteoporosis, you want to make sure that they're getting advice from their doctor or from their physical therapist. Programs that include muscle strengthening, balance training, and coordination exercises are highly recommended. The balance training and the coordination exercises are particularly where yoga can be really useful. Okay, and frail elderly individuals with poor balance, mobilization should be supervised by physio or physical therapists and supported by strength and balance training. Exercise can also play a crucial role in rehabilitation. Muscle strengthening exercises can help to rebuild bone, and they can also provide relief from pain if pain is part of this for individuals. People with osteoporosis or previous fractures should consult their medical professional before starting an exercise program. Yeah, so hopefully that's common sense. Okay, and then we have the Royal Osteoporosis Society. Okay, so they come at this with a slightly different tone, which is kind of interesting because I want to look at all the different recommendations and show that each of them come from a slightly different angle. So they say, number one, adopt a positive, encouraging approach. Okay. Explain that fractures are rarely caused by exercise and the benefits of exercise outweigh the risks. Okay. The last thing you want to do if you have osteoporosis is slow down. Okay. You want to remain active. You need to get guidance for it, but you do not want to slow down. You do not want to become sedentary. Modify extreme or loaded flexion, but they say unless you're used to the movements or you have very good muscle tone. So there's nuance here, okay? So if you are working under the guidance of a physical therapist, you might be able to learn how to, pick something light off the floor with a rounded spine, and then over time that could become heavier. You're going to progressively increase under the guidance of someone, so there is nuance here to this. Yeah. So this is a little infographic from the Royal Osteoporosis Society, and I can share a link to this when we share the presentation with you all. But I just find this really helpful. I really love infographics. So they're saying, focus on being strong. So build bone and muscle strength. They talk about weight-bearing impact exercises, things like skipping, playing tennis, running, jumping on the spot, lower impact, climbing stairs, walking, hiking. Yeah. So you're going to increase this gradually. Okay. Increase the intensity. Sports, you're going to start off with general things like carrying your shopping, taking the trash out, vacuuming, gardening. You're going to then increase maybe a little bit of rowing. You're going to eventually, go to the gym, go to yoga classes. Yeah. So it's going to be this progressive thing. Improve balance with Tai Chi, with dance, with yoga. Yeah. Adopt a positive approach. And then this is also helpful. They've given some postural advice here, but also they're, saying things like loaded flexion. So we're going to avoid going into halasana here. This makes sense to me. We're not going to, do extreme poses like this. They're even saying that for some people, if you're lying on your back, hugging your knees into your chest and rounding your spine, that might be, too much for them. We're going to avoid doing stomach crunches. We're going to avoid maybe folding over with a rounded spine in a standard forward fold. We'll look at this in a little bit more detail. Yeah. So Amy says, backing up a bit, loaded flexion is a bad idea even without osteoporosis because most people have disc damage that will cause pain. Better train muscle stability. Okay, so Amy, that's another topic, but that's a little bit of an outdated approach. Spinal flexion gets a bad rap, but it's not evidence-based. Okay. So as long as you're progressively flexing the spine over time, there's no evidence that it causes disc damage. And actually, many of us have herniated discs without even knowing it. It's very possible to have a herniated disc and no back pain. Yeah. So I would say I share a lot of information about this on blogs and on social media. I would say, take a look at some of that information, and that might change your opinion, a little bit on that. But we do need to flex our spine, and honestly, we can't avoid flexing our spine in everyday life. It's really an important movement for us to be able to make. Okay, so this is a big one that I want to share with you. So this was a very high quality randomized controlled trial that's referred to as the Lift More trial. Okay, and this is from 2018. So Lift More stands for Lifting Intervention for Training Muscle and Osteoporosis Rehabilitation Trial. Okay, and the purpose of this study was to determine the efficacy and safety of high intensity resistance and impact training to reduce parameters of risk for fracture in postmenopausal women with low bone mass. Okay, and we're going to dive into this and look at what the study showed us. So they gathered 101 postmenopausal women with low bone mass. Okay, they were randomized to two groups, either 8 months of twice weekly 30-minute supervised high intensity resistance and impact training, HIRIT, that's what we're going to call that group, or home-based low intensity exercise program, and this was called CON. Okay, so there's two groups that they've been randomized to. So pre and post intervention testing included looking at bone mineral density of the lumbar spine and the proximal femur, and then measures for functional performance, like timed up and go. So how long does it take you to get up and go from your chair? Functional reach, 5 times to sit and stand, back and leg strength and things like this. Yeah, so these are the things that were measured before and after the intervention. So for the high intensity and resistance group, to ensure safe transition to high intensity exercise, the first month of the intervention comprised body weight and low load exercise variants with a focus on progressively learning the movement patterns. Okay, all participants were able to perform the 4 fundamental exercises of the intervention within 2 months. Okay, so there were resistance exercises. So this included doing a deadlift, an overhead press, and a back squat, and they were performed for the remainder of the period. Obviously, I'm showing a large weight here. This was a progressive thing. Not everyone got to a weight like this, but it was progressively increased. This was just a helpful diagram to show you, what the exercises look like. Okay. So participants performed up to 2 sets of deadlifts at 50 to 70% of their 1 repetition maximum. So basically, working with a physical therapist, you can work out what is the heaviest load that you can only lift once, and then you take that to about 50 to 70%, and you do 2 sets of those. Okay, that was performed as a warm-up, and then 5 sets of 5 repetitions. And this is at about 80 to 85% repetition max. So don't get bogged down in the detail, but I just want to show you, this is a very, very thorough study that was done. Okay, very thoughtful, very clearly described. Impact loading was applied with jumping chin-ups with drop landings. This is a little bit confusing, but just bear with me. So participants were instructed to grasp an overhead bar with their shoulders and elbows flexed to 90 degrees, with their hands shoulder width apart with an underhand grip. And then they jumped as high as possible, pulling themselves up, and they jumped off of a small box. Okay, so yeah, don't get bogged down in the detail. That's just an example of a high impact exercise. So at the peak of the jump, the participant dropped to the floor, focusing on landing as heavily as comfortably possible. Okay. Each exercise session was performed in small groups, a maximum 8 people per instructor, and the instructor was an exercise scientist or a physiotherapist. Okay. Now, what about the other group? They did 8 months, twice weekly, 30-minute home-based low intensity exercise. Okay. And this is like 10 to 15 repetitions, less than 60% of the 1 repetition max. And this was designed more to improve balance and mobility. Okay, the intensity of resistant exercises progressed from body weight to a maximum of 3 kilogram hand weights for the final month, just to give you an idea of the difference. They did a walking warm-up and cool down. They did low load resistance training, so lunges, calf raises, standing forward raise, shoulder shrugs. Okay, and they also incorporated stretches into this. Let's look at the results. So the high intensity resistance training effects were superior. Okay, so let's look at the lumbar spine bone mineral density. It increased by 2.9% versus minus 1.2%. So for the home-based exercise, they actually decreased in bone mineral density over the 8 months. Okay, for femoral neck, there was an improvement of 0.3% versus minus 0.19%. So again, there was a decrease there on average. Yeah, similar, vast improvement here. Femoral neck, even the person's height, there's a slight increase versus a decrease in height in the other group. Yeah, and then all functional performance measurements were superior in the high intensity resistance training group. So the high intensity resistance training program enhanced indices of bone strength and functional performance in postmenopausal women with low bone mass. HIRIT was efficacious. Okay, I can normally speak quite well today. I don't know what's happening. And induced no major adverse events under highly supervised conditions. Okay, so there were no major adverse events, even though they were doing what could be looked at as kind of quite extreme exercises, obviously under guidance. There were no adverse effects. Okay, so really, really exciting to know that there are programs like this that will increase bone mineral density in people that have low bone mass. Okay, so I'm just going to check in quickly at the chat. Loaded, yeah, so not general flexion, loaded flexion. Similar thing. Amy, I personally wouldn't think of loaded flexion as necessarily a bad thing. If you use the progressive overload principle, and if you load the spine progressively over time, there's going to be no harm done. Yeah. So flexion definitely gets a bad rap. It's not something that's evidence-based. Okay. So let's look at this now. Can yoga alone reverse osteoporosis? Okay. So there was a study in 2016 that examined whether yoga asanas can positively affect bone mineral density in people with osteoporosis. Okay. And it had this title, 12-minute daily yoga regime reverses osteoporotic bone loss. Okay. Now, it received a lot of press, but the study has received also a lot of strong criticism for its poor research methodologies, and the results are incomplete and inconclusive. So despite having this very, very promising title, when you start to scratch the surface, you realize that this is not a good quality study, unfortunately. So let's take a little dive into it. I just want to show, it's been shared all over. Recently, it was shared by Yoga International on all of their social media. And unfortunately, it's really unhelpful sharing this without really diving into the research. It's all basically clickbait, So, yeah. And if, you do a Google search and you will find so much about yoga for osteoporosis, about as if yoga alone is going to reverse osteoporosis. So there's a lot of misinformation out there. So let's take a little look at this. So the study looked at the effect of 12 specific yoga poses. It was conducted over the course of 10 years. That's pretty impressive. Of the original 741 subjects, 227 were moderately or fully compliant. Okay. And of those 227, 202 were female. The average age was 48, and 83% of them had osteoporosis or osteopenia, just to give you an idea of what's happening here. So they used a 12-minute yoga DVD every day that contained 12 yoga poses. They were given written instructions. They could also attend online webinars and things like that. They compared pre-yoga bone mineral density to post-yoga bone mineral density of as many subjects as they could. And a bone quality test was also done on some subjects. Okay, so here are the poses. So they chose these yoga poses because they felt that they targeted areas of the body where there are often fractures due to bone fragility. So, very classic poses, nothing outside the box here. So of the original 741, we said 227 were moderately or fully compliant. They don't explain the difference between what that is. Compliant was identified as more than every other day and having done more than half of the poses. Okay. It's unclear how many people consistently did the 12 poses every day and followed the instructions. It doesn't explain that in the study. Later, it is stated that 57, and then they also say even later, 43 subjects who were moderately to fully compliant. So basically, you kind of lose sight of how many people actually followed the instructions. Okay. And then the bone quality test was only done on 18 people out of the original 741. So it becomes blurred, and these discrepancies are not clarified. So the numbers are like all over the place. Okay. So the results, they compared pre-yoga bone mineral density and post-yoga bone mineral density. It's unclear how many subjects that was. The improvements in bone mineral density were less than 0.0005 grams per centimeter squared per month. Okay. So basically, this is very low. This is not significant, statistically significant, an increase. So there is a tiny increase, but it's not statistically significant. Okay. It's unclear what impact this would have had towards reversing bone loss that is mentioned in the title, of the study. Bone quality of the 18 patients completing the study was judged as superior to those without yoga experience. So all of a sudden, they add this layer of comparing people who have yoga experience versus no yoga experience, even though that's not mentioned until the end. So it's kind of really confusing. They did the test on the left hip only. No yoga-related injuries were imaged or reported, but that doesn't mean that no yoga-related injuries happened. So again, it's really unclear the way they described it. Let's look at the limitations. So there are many limitations, and they in the paper, the scientists actually say themselves, this study suffers from many drawbacks, which makes it really impossible to derive concrete conclusions. So the study is not detailed enough to be repeatable. Like, you couldn't read the study and then repeat it yourself and get the same results. It's so confusing. It's so poorly described. The subjects entered their own data online, so that comes with its own limitations, leaves a lot of room for error. The duration of the study leaves the door open for more error. It's unclear if the same people who started the study were the ones that finished it. Compliance was assessed by the subjects themselves. Some subjects used the scorecard incorrectly or inadequately. You know, the list goes on and on. It's unclear how many subjects were compliant. You know, it appears that the number of subjects is too low. So basically 18 out of the original 741. Like, that's not helpful. Yoga may have more benefit for those who are not already practicing. This wasn't taken into account. Other factors were not clearly controlled. The results were not statistically significant. How they come up with the title is an absolute mystery. The study stated that there were no competing interests, but it was funded by the main researcher, Dr. Fishman. So he paid for the study, and he now sells books and sells courses based on this. So there's a huge conflict of interest there. Based on the results of the study, can we say with certainty that yoga prevents bone loss and helps rebuild bone mass? No, we cannot, based on this study. We cannot make that conclusion. Yoga helps by increasing body awareness, coordination, and fall prevention. These are really, really important things as part of the bigger picture. We know that bones develop more mass progressively over time if the applied forces are increased. Okay, and yoga is simply not progressive enough to help to reverse bone loss. Yeah. So if you have a sedentary lifestyle and you've never practiced yoga, yoga could be a helpful step towards becoming more active, but ultimately it's not going to be progressive enough to take you further along the path. Yeah. So Kari says, when you say that our skeleton or bones are renewed every 10 years, does that mean that high intensity activity can reverse osteoporosis? Yeah, so based on the Liftmore trial, very good quality study, it shows that high intensity exercise and resistance training can over time begin to reverse osteoporosis. It obviously needs to be done ideally under the guidance of a physical therapist. So Wanda's asking me, is there a similar program? Yeah, well, basically the HIRIT, it's just a way of describing the exercises that they did. So we're talking about a blend of high impact training that also needs to be done progressively, and then resistance training. So basically weight training or using resistant bands. Yeah, so it's a blend of those. Yeah. Okay, so if you have a student who comes to class with osteoporosis, here are some helpful questions to ask. Have they consulted their healthcare professional before coming to yoga? Like that's a big one. Okay. Are they currently working with a physio or physical therapist? It's going to give you an idea of where they're at today. Yeah. How active are they currently? If they have a completely sedentary lifestyle, then yoga is going to be a big step up for them. If they're already running and working with a physical therapist and going to the gym, then it gives you an idea of the context. Yeah. Which areas of their body are affected? So my mum has osteoporosis of the spine, but none in the hip. So it's, so then if you have osteoporosis of the hip and not the spine, then that person doesn't need to be as cautious when it comes to flexing their spine. Yeah. So again, there's nuance here, and it's going to depend on the individual and depend on all these different factors. How severe is their condition? Do they have quite mild osteoporosis? Do they have quite severe? It's gonna dictate how you work with that person. Have they sustained a fracture before? Are they on medication? Are they on medication for their osteoporosis? Yeah. So some of these questions can really help you to build context, because you can have two people beside each other that both have osteoporosis. They both have a very different experience. Everyone's going to have their own unique experience of this. Yeah. These questions can help you to add the context to it. So some guidelines for teaching a student with osteoporosis: adopt a positive, encouraging approach. You want the student to keep coming to class and to stay as active as possible, okay? Explain that fractures are rarely caused by exercise. There's a lot of fear around moving when it comes to osteoporosis, okay? The benefits of being active outweigh the risks, okay? Having a sedentary lifestyle is a higher risk. Okay, start slow and steady and gradually progress the poses. Okay, so here's the flexion example. Yeah, with someone with osteoporosis, we're not going to want to do deep flexion. I think it is safer as a general rule, to not be going into deep spinal movements. And here I'm not using the strap as leverage to pull me in, so I'm still going to do some gentle flexion, but it's just a different approach to the pose. And on social media, I share a lot of pose variations, so definitely check that out. Here's a big one about rounding the back. So rolling up from a standing forward fold can put a significant amount of stress on each level of the spine during the transition. Okay, so if a student has osteoporosis of the spine, a good option here is to place the hands at the back of the legs. So it takes the weight of the arm out of the equation. Okay, and you could maybe over time roll up, as long as it's done progressively, or you could rise up with a more neutral spine with the hands on the hips. Yeah. So, definitely different approaches. And then, I would also avoid raising the arms when moving into a forward fold. A lot of people will come into Dandasana, raise the arms. You're adding the weight of the arms as you fold. So I would avoid doing that. I would keep the hands on the hips, walk the hands along the thighs or the floor. Yeah. So very little empirical evidence exists about the effects of spinal rotation and lateral flexion on people with osteoporosis. So there's some research that's really looked into this. I would say there's no basis for informing people with osteoporosis to completely avoid spinal rotation or lateral flexion, but I would focus on mobility over flexibility. So here in the diagram, I'm using my muscles to twist instead of hooking that arm over the knee and kind of levering myself further into the twist. Yeah. So that I would focus on mobility over flexibility. And then focusing on a progressive approach to floor-based back bends could also be helpful. There's lots of helpful ways that you can slowly increase the back bend in a progressive way. What about yin style forward folds and other poses? Well, if you're being supported in a forward fold with props, then that might feel different because you're not bearing weight, here. So that we can take a different approach. It's going to depend on the individual, really. And then, reduce the risk of falls during a class when practicing balance poses. So balance poses are really important, but, use a chair, use a wall, use a partner when you're doing balance poses. Yeah. So, sorry, just, to finish that off. Okay. Okay. So we've covered a lot of information. We're going to do a quick self-test quiz. You can, if you want to, you can share your answers in the chat, or you can just reflect at home. There's no pressure. Okay. So, can you give 2 examples of where we have variation in the number of bones in the human body? Can you think of 2 places where we have variation? Yeah, thanks, Kari, for sharing. Is this true or false? Peak bone mass is achieved by the mid-teens. True or false, it has been estimated that a 10% increase in peak bone mass in children reduces the risk of an osteoporotic fracture during adult life by 20%. Is that true or is that false? Have a think. Okay, thanks for sharing your answers, everyone. It's great. What type of cells are bone-making cells that initially live on the outside of the bone, turn to osteocytes, and then become embedded within the bone, causing new bone to be laid down? Can you remember the name of those bones? Again, it's not going to make you a better yoga teacher knowing the name, but you know, something of interest. Every bone in the body is completely reformed about every how many years? What is the progressive overload principle? Like, can you think in your own words how you would describe that to someone? Great, just checking on the answers. Brilliant, everyone. Yeah, great, thanks, Susan. So osteoporosis is often referred to as a what kind of disease because there are typically no symptoms until a bone is broken. What did we call it? All right, a lot of people were listening to me today. It's good. Can you list 2 risk factors for developing osteoporosis? We went through quite a lot of different risk factors. Can you think of 2 things that could potentially increase your risk? I'm gonna go through the questions in a second, the answers. I'm going to zip through them again. And then I think this is the last couple now. What are the 2 most effective types of exercise for reversing osteoporosis that we've mentioned? So we particularly looked at those in that big study. How do we classify the 2 types of exercise? Is there strong evidence that yoga alone can reverse osteoporosis? What role can yoga play in managing osteoporosis? Where does yoga really, play a central role? Which spinal movement needs to be practiced particularly mindfully, when we're talking about osteoporosis? What's the movement of the spine that's just we're gonna give a little bit more attention to? Great. Okay, so let's quickly look at the answers. Blah, blah, blah. Okay, so we have variation in the vertebra, in the digits, in the number of ribs that we have, yeah, in the sesamoid bones in the feet. This is false. Peak bone mass is achieved by the mid-20s. This is also false. You decrease the risk by 50% when you have a 10% increase in bone mass in children. Osteoblasts are the bone-making cells. So I saw a lot of you get that in the chat, which is great. Every 10 years, each bone is reformed, essentially. You get a new bone. So the progressive overload principle is that if you want to increase either the strength of your muscles or your bone mineral density over time, you need to keep increasing the volume and intensity of the load applied. Yeah. Osteoporosis is called a silent disease. 2 risk factors. It could be smoking, it could be sedentary lifestyle, family history, taking certain medications, having certain medical conditions such as celiac disease, low protein, malnutrition. Yeah, there's a lot of different factors. So the 2 most effective types are high impact. Think skipping, that's one. It's quite low load skipping is surprisingly. Think of that. There's something called plyometrics that you might want to look up. And then resistance training. So whether that's using a resistance band or starting to use, free weights. Yeah. There is not strong evidence that yoga alone can reverse osteoporosis. Yoga can help by, helping build bodily awareness, helping prevent falls. Yeah, helping with coordination. There's a lot of great things that yoga can do. We're going to be particularly mindful about flexion of the spine. Okay. Look, we've covered a lot of information. Take some time to reflect on what we've covered. Write down 5 things that you'd like to take away with you and share this information with someone else. We are going to share all the references that I've mentioned, and we're also going to share a copy of this slideshow presentation with you when the replay goes out in the next couple of days. So rewatch this, and you get to keep the slides in the future. Reach out to me. You can email me at info@dryogi.com. Yeah, so we're going to send you the references. But if you'd like a certificate for today, for this hour, put osteoporosis as the subject of the email. And, within the next few days, the next week, I will be able to send you, a certificate on that. I run a really wonderful 30-hour yoga anatomy online course. It's on demand. You have lifetime access to the material. It's always getting updated, but you also get to come and spend time with me every 5 weeks where we do a live Q&A as a group. So, if you really want to stay up to date with the latest kind of evidence-based information around the human body applied to yoga, this is a great one. As a thank you for joining me, you get to use the coupon code beYogi15 and you get 15% off of that. So we'll send you a link to that for sure. I run this workshop a couple of times a year, and basically over 2 hours, so just more detail. I also run one on demystifying arthritis, one on demystifying low back pain. So if you enjoyed the way I presented this today, definitely keep an eye out for those. And it's been such a pleasure sharing everything. So Hilary, if you wouldn't mind just sending me a quick email, the info@dr-yogi.com, then I can definitely send you that. So thank you all so much. Let me know if there are any additional questions. You can also email me. Jumping on a small trampoline considered high impact. Yeah, it's a little bit more low impact, but it's definitely a good starting point. You could start on a small trampoline and then you could build up to actually jumping on like a harder surface. Yeah. Is there a limit to the amount of weight we should lift? Yeah, 100%. You need to do this under the guidance of a physical therapist. You want to start low and then you want to progressively increase. Yeah. Yeah, so yoga alone can't reverse osteoporosis, but it can be an important stepping stone to increase an active lifestyle. 100%. I'm such a huge advocate for yoga, but I don't want people to believe that yoga alone can, and therefore all they do is yoga and they shy away from doing any other activity. That's actually not going to help them, in the future. So I agree with you. Amazing. Just checking to see if there are any other questions. Yeah, email again. We will share it with you, but it's info@dr-yogi.com. How is running as it relates to bone health? Yeah, so running is going to actually be good because it's reasonably high impact. But you also want to challenge the body. So try skipping as well, and try hopscotch, and try different things. There's different ways to keep challenging the body to keep building bone. Yeah, and if you can just put osteoporosis in the subject title, that would be great. All right, everyone. Lizzie, I'll pass back to you.
Totally. Well, thank you so much, Andrew. That was a plethora of information, and we will, no, in a good way. And we will send you guys the slides and the references so you can continue learning. Definitely rewatch this webinar. So amazing. And thank you, Andrew, for your time today. It was really fun.
It's been a pleasure. Thank you all for just coming with an open mind and for, engaging and asking your questions. It's been really great. And I look forward to connecting with more of you. in the
Amazing.
future, for sure.
We will put all of Andrew's contact information, including his Instagram handle and all that good stuff, in the email we'll be sending out with the webinar replay tomorrow. So definitely reach out to him. Alrighty, everyone. See you at the next one and enjoy the rest of your day. Bye-bye.
Thank you so much.